It's Rosie.
All right, so today we have Dr. Rosie Ward. She is a consultant, professional coach, and author known as a thought leader who challenges the status quo, pushes boundaries, and engages people and organizations to find success through shifting old, ineffective thinking habits. She has a diverse background with over 20 years of experience promoting well-being, employee engagement, and transforming organizations in various settings. She has degrees in kinesiology, public health, and a PhD in organization and management, where her research focused on organizational culture, intrinsic motivation, and coaching. Dr. Ward is regularly interviewed for business publication, is a contributing author to the book Organizational Development in Healthcare, High Impact Practices for a Complex and Changing Environment, and she is also the co-author of the book we're discussing today, How to Build a Thriving Culture at Work, featuring the 7 points of transformation, with her co-author, John Robison, and we are super glad to have her here today. Rosie?
Thank you. So I actually spoke to John this morning, and he told me, in the spirit, those of you who know John, he said, tell everybody the truth of what's going on. So for those of you that don't know John or do know him, his wife Geraldine was in a horrific car accident late Tuesday night, Wednesday morning. She's in the ICU. She's in very critical condition. He was very emotional this morning and said she's very lucky to be alive and she's not out of the woods yet, and hoping and praying that she will recover. She's going to be in the hospital for many weeks and recovering for many months. So they have a very long road ahead of them. So and on top of that, then he got sick and has pneumonia. So when it rains, it pours. So John apologizes for not being able to be here today. It would have been a fun to have the both of us, but I guess I would ask that all of you keep him and Geraldine and his son Josh and all of them in your thoughts and prayers, and hopefully she will make a full recovery. So that is why he is not here today, and he wanted me to share that with all of you because that's John saying, let's be real. So that, I guess we get this party started, Michaela. So
all right. Well, let's see. I guess, can you talk about how this book came about in the first place?
Yeah, it's kind of funny. So I've known John for several years, and him and I were talking. I want to say it was probably 2012, 2013. It must have been 2013, and we were talking about his book that he wrote in 2004. We were talking about doing an updated version, and he wanted to see if I wanted to be his co-author this time. And so we were starting to talk about it, but then we were talking about how different in 10 years the world has been, and about the work that I do, really fusing organizational development and culture. And as we started talking, we realized this isn't going to be a rewrite of his book. It needs to really be an entirely new book. And so in September of 2013, I flew to Michigan to hang out with John for a weekend and just kind of to powwow and start going through an outline and figuring out what do we want to call this, what do we want to do, what do we want it to be about. So we were both talking about the work that we do. There's a lot of alignment, but some of the unique stuff that both of us do, and the work that we're asked to do, and when we speak, the things that people ask us, and how can I learn how to do this, and how do we put this down as that would be meaningful for people. And that's kind of where it was born. And I was telling him that in my consulting practice, I had been just starting for a while to use a house analogy because it seemed to resonate with people when you were trying to get them to figure out, why don't you just jump in and start doing stuff. And I found that analogy resonated. So that's kind of where we ended up coming up with the house analogy, and eventually the 7 points of transformation was kind of how we collectively consult with organizations and using those steps, but not necessarily calling it that, and kind of getting the framework together. So then the process started, and it was a lot of writing, a lot of back and forth, but it was really fun. I think that we write and think a lot alike, but it was great because areas that maybe I had more knowledge, John had more knowledge in other areas, and we were just a really great complement off of each other as far as the whole writing process. And so that's how it came to be.
Yeah, it does seem like kind of a well-molded group think between the two of you.
Yeah.
It's pretty awesome. Yeah. Well,
it was fun. It was a lot of fun.
I imagine. The good, the bad, and the ugly, but mostly good. But some of that, I guess, if we go with that analogy, some of the yucky, negative crud that's been going on the last year or so, and like have accused you and John of being sort of anti-wellness.
Yeah.
So,
I always laugh at that, and because I've made no secret for the last several years when I do speaking engagements, and I used to tell more of my story before, and I don't tell it as much anymore. But if anything, I am so the opposite. I am so passionate about figuring out a way to better support employee well-being. I used to say after my undergrad and master's degree, when I realized that what we were doing didn't work, it was a really disheartening realization when you have lots and lots and lots and lots of student loans to realize that this doesn't work. And that was back, a long time ago. And so, but I was like, there's got to be a better way. And so I kind of almost feel compelled that if we don't do something differently, that the field that the area that I love so much, and that I've met so many awesome people, that we're all going to be looking for jobs in a few years. I just really feel that strongly. And so for me, it's a passion of how can we be relevant? How can we survive? How can we thrive? You look at the IT industry, you look at the communication industry, you look at any industry, and they profoundly transform over time. And so for me, it's about how do we evolve our field, because I feel like we have just been stuck. And so it's not anti-wellness, it's anti what John and I call wellness or else. It's what wellness has become. When I got into wellness, it was forward-thinking companies did this because it was the right thing to do for employees, and they would offer programs and resources and services that were really holistic. And it turned into this very narrow wellness or else. Not everybody, but the field in general has turned into this very narrow biomedical focused health risk factor reduction attached to heavy incentives, penalizing people, trying to force behavior change, and it's just this little teeny sliver of a human being, and that's what we call wellness or else. It's basically trying to force people to comply, and not looking at the holistic concept, not looking at culture. And so I feel like we've gone completely backwards from where wellness started, and so we're criticizing what it's become, and it's the wellness or else. There are a lot of great people out there that are absolutely doing holistic programming and are looking at culture and are looking at the context, but so much of it isn't, and so much of what got into the Affordable Care Act is wellness or else. What has driven a lot of growth in this field has been wellness or else. And that's what we're against, because that's what I think is not working. And when you go to try to support employees and then it doesn't work, so now we're going to hammer them, and with the wellness or else. And then when that doesn't work, then what? And I think a lot of money is being wasted on stuff that isn't working. You have EEOC claims that are popping up left and right. You have employees that are revolting. It's having impact on morale. That's the stuff that we are against. I'm not anti-wellness. I think, and if the people who read our book, it's a fusion. I don't believe that you can actually have thriving workplace culture if you're not also supporting employee well-being. You just can't do it in this wellness or else way. So I think that those criticisms are really unfair, because I look at it as trying to look at how can we broaden our scope, how can we transform like every other industry has to do to be relevant and actually usher us into the 21st century based on this data that keeps coming forward. And instead it's like this mudslinging, thing happening and people having tantrums versus kind of saying, hold on a second. And I guess I look at it as, having been a person who developed and created a lot of these programs in my past, and having run these and listened to the literature back then and realizing it didn't work, I had to kind of take a step back and not take it personal when I would hear employees say, I delete your emails because I don't care, or they would pretty much tell me to go away. Or when I would kind of take a step back and realize employees actually are not liking this, or they're not liking a lot of it. There's certainly few that are, and I had to take a step back and not personalize it and say, okay, there is something clearly to learn here about the reaction. If we're supposed to be providing these programs and services to help improve and maintain people's well-being, and we're supposed to be doing this with them or for them, we're having the opposite effect. And so I needed to look at intent versus impact. Our intentions may be great, but the impact we're having was not great. And so, and I think a lot of the people who actually kind of supported getting this book off the ground, it's people who've, talked to me, talked to John, have said over the years, this resonates with me, I'm so frustrated, this isn't working, or there's got to be a better way, or thank you for what you're doing. That's what kind of drove us to create Saleo Partners and to create this book. It was off of other people kind of saying they're feeling the same way. And so I feel like there's this polarizing thing happening right now in the field of worksite wellness, because you have people who are the practitioners out there, who maybe are consultants, who are seeing that there needs to be a better way, And I feel like the majority of the people who are fighting and mudslinging and saying you're anti-wellness are the people who have built a business around that old paradigm that isn't working. And I get it, their livelihood is being threatened, but I just think there's such an opportunity for us to come together. And so that's my long-winded answer. I think we're both actually very passionate about ensuring not just the survival, but the thriving and the growth of our industry. And right now, I think that the when you see all the blogs coming out and news coverage and all that stuff, wellness is getting a bad rap, and business owners and business leaders are getting impatient. And I think that us having completely attached ourselves to healthcare costs and ROI that's coming under attack and all of those things is going to be the death of us if we don't start to shift gears. So there's my long-winded answer. We are absolutely not anti-wellness. We are anti-wellness or else.
Yeah. Yeah, it's really a good point. If you start focusing on the dollar, if you attach to the dollar, if the dollar is the thing, then the dollar is always going to be the thing, and you can't get beyond that.
Mm-hmm. Yeah.
So let me ask a question that's ever so slightly off topic, ever so slightly. Ever so slightly. Salveo Partners. Is that a word that I'm not familiar with that everybody else in the world knows?
No. So Salveo Salveo is actually the Latin word meaning to be well or in good health. And so when you think about that broadly, it just fits so well, because it's really about organizational health and to be well, and individual health and to be well. And so when you think about that's just the word Salveo, and Salveo Partners is really, well, it has multiple meanings. I mean, first of all, we're a partnership. John and myself and Sean are their business partner, but it's also you're partnering. An organization is really partnering with their employees. If you think about that employment contract or their employment brand, that's a partnership. When you look at, if you're consulting with an organization, you're partnering together. If you look at, we want to partner with great people to affect change. So partnership also has a very broad scope when you think about it. So that's kind of where the Salveo Partners name came from. And it's actually been in existence since 2006 as far as the name and stuff goes, but it's been repurposed in a awesome way, more than I could ever imagine with the work that we're doing.
Yeah, that's really interesting. I think what you said about partners.
Oh, there's
hey, I see a kid.
Sorry,
dude.
I'm holding a sick child on top of it. Sorry. Yes. We can go to dinner later. You gotta go watch your iPad. Sorry.
All right.
Okay. Multitasking mom.
That's all right.
Both just met Peyton. If he was in the book, there we go. That's him now as a 4-year-old. Okay.
Who needs a picture when you can have him live on camera?
I knew it was gonna happen. I knew it. Okay.
Yeah, that's okay. That's okay. I can either edit him out, or I can. Oh, here he comes again.
He wants to be in here with me. That's fine.
Okay. All right. Well, he can totally give you bunny ears. I hope he didn't hear me say that.
Hey, it's all good.
Thinking about partners, I think that's kind of a key message too, because if you're partners with someone, whether it's you're the employer and the employee, or you're partnering with someone, it isn't I'm going to partner with you and I am going to so get what I want out of this. It's
right. Right. There's mutuality, right? You can't have a partner by definition. A partnership is mutuality, and so I think. Whether you're coaching with someone, it comes from that standpoint. Yeah, I even think, if you're a leader in an organization, I look at the team that I lead, it's mutuality. I mean, it's about how can I, we support each other. How can I develop you? Those types of things, for sure.
Yeah, absolutely. Sorry about that, Stephanie. I totally forgot to share the screen. Duh. Okay, let's see. Rosie, please give our best to John and his family. I'm reading the subject book as per instruction. Yeah, I did kind of make that point, didn't I? About the chapter, let's see, just now on the chapter discussing the 7 points. Probably the majority of us are in the stuck phase of wellness promotion. Even if well-being is effective on an intrinsic level, and will only be last if approached in this manner, does it not make sense to introduce the traditional approach to a short-term in the short term for a consistent flow and saturation of the population health. Yeah, it's darn hard to read that. Sorry.
I'm trying to decipher.
Yeah, let me actually, yeah. So basically, I think she's saying that, isn't there a place for sort of the traditional and then to move into more of what you're talking about? Or, I mean, basically, how do you get unstuck? How do you...
Well, so we do talk about that in the book, and I guess here's my response to that is to just do what we've always done because that's what we know. But if we are seeing the data that it's not working, it's kind of like, think about the fiascos with the Pintos or something. Or would you build a cardboard house just to get something started, knowing that it's probably going to crash in on you later, and you're gonna or use faulty materials for a house and knowing that you're going to have actually more work later to pick up the pieces. And so when, what I've done, and I don't think it's black or white because everyone's all over the board. What I can say is that over the last, 8 years, as I've consulted with organizations, if they have not done much in the way of employee wellness, then our discussion is please don't start down this road that you're going to have an uphill battle to crawl out of. And I've had several organizations that were absolutely they want to just jump right into the deep end, and they want to go into outcomes-based programming because they got guidance from their health plan or their insurance broker or whatever it might be. Mm-hmm. And so then I was trying, but they wanted to work with me to figure out how can we fill in the gaps around that to minimize the damage. And so we tried. And then it was very kind of funny. The next, within a year, I just remember one individual said to me, "We should have listened to you. That was not the best thing to jump in." I'm like, yeah, well, sometimes you have to feel the pain, right? So, and so, I mean, I guess it gets back to knowing the organization. If you, I have had organizational leaders who got information somewhere, again, wellness is booming on kind of bad data, and I would give them data to the contrary. And try to encourage them not to go down a path that was going to leave them scrambling later. Sometimes they would listen and sometimes they wouldn't. I mean, that's the reality of it. And those that didn't, I have yet to have someone then not feel pain and go, man, we should have listened to you. That was a waste of a couple of years. Or that was, I did a speaking engagement several years ago. And I remember I was talking about incentives, and there were some people there, and they said, we already down that path, so we're just going to see what happens. And they literally called me up 2 years later and said, we just were so disheartened, we didn't know what to do, but gosh, we should have listened to you because this is what's happened. And the list goes on and on. And so I feel like if a company hasn't gone down that road, why would you start knowing that you're probably going to have a lot of repair work to do? And it's a lot harder when employees have been disheartened about having wellness or else or done to them. It's really hard to change their perspective and get them to come back on board later when you try a different approach. That said, I also work with a lot of organizations, and we give examples in the book that have been doing the old paradigm approach, and you have to figure out what makes sense. And we say this in the book, but if you're looking at where do you start, well, you know what, a really simple thing is if they're putting a whole lot of money in biometric screenings and health risk assessments, why don't you repurpose that money and take a break from it and look at what are your employees actually wanting? Are you needing more support in career development and training and development, and can you repurpose those dollars? Can you invest in high quality coaching and help them navigate the adaptive challenges that they're facing in their life? And kind of along the lines of, maybe not becoming a deliberately developmental organization that we talk about in the book, but doing similar type of work that has far greater meaning for employees than making them kind of jump through hoops for an incentive. So kind of looking at within what you have, can you repurpose dollars and reallocate stuff and reconsider that approach? We do give an example in the book of people correcting for incentives and saying, okay, fine, if you're stuck with this point-based structure and if you're locked into a vendor contract, can you repurpose how you let people earn the points? And again, focus it more towards letting them work on their own individual well-being. Since we wrote the book, I learned about, I didn't know it was in existence then, but not surprising, that Zappos actually launched they call it a gold program, and they basically kind of along the lines of what DDOs do, they are really giving people access to coaching and resources to work on their own personal development and growth versus just professional. And they said, if we invest in both personal and professional, why would people ever leave? And so there's a big movement in really helping people navigate in the leadership development world, there's a whole bunch of work going on teaching leaders to be adaptive leaders. You can't do that without having some personal growth and development. So I think there's ways to repurpose dollars, refocus. But if you're in a silo, what I think is, it's who do you need to talk to in your organization? Well-being and culture isn't a solo job. It's not the HR person's job. It's not the wellness person's job. It's a collective collaboration. And so start to think about who in your organization do you need to start to align with, start to have conversations with, that it's a journey, it's not a sprint, and looking at how can you slowly but surely shift the tides. And if you're locked into a contract or you're stuck doing this for a year, how can you start to slowly minimize the damage and add in other things with the goal of hopefully kind of moving away from that over time. If organizational well-being is really suffering, then that's a place to start. And backing off on some of the wellness stuff, and I think sometimes I hear from wellness people, well, then we won't have a job. Well, no, because you can do so much stuff around work-life balance and stress management and helping people think better and helping them be aware of their well-being. You can do stuff on healthcare consumerism. There's so much programming, if you will, that we talk about in transformation point number 6 that you could do in lieu of the traditional wellness or health stuff that could start to at least move the needle while you're getting together the bigger strategy.
Yeah, absolutely. As you were talking, I was thinking, no, we wouldn't be out of jobs because we would be working with people versus working on people.
Well, there's that. Right, exactly. And I think the jobs would grow because the reality is that, and this is where I think that wellness, the people who are fighting and stuff need to just kind of take a step back for a second. And when you look at the people who have no background in employee well-being or wellness or health, but they are recognizing the importance. So Robert Keegan and colleagues who are doing their deliberately developmental organizational work, their background's not health and wellness. Tony Schwartz, his background's not health and wellness. Tom Rath and Jim Harvard, their background's not health and wellness. You have all of these people in the culture, leadership development, OD space who are getting how important well-being is, but they get it at a broad level. And health and wellness is stuck in this narrow biomedical model. And I look at who's going to have the jobs in 5 years. It's going to be the OD people who don't have the background because it's aligned with organizational strategy and objectives. Yeah. And it's not just healthcare costs. And the other thing, too, is that if you think about with Lord knows what's going to happen as healthcare reform continues to unfold, but with a lot of people, a lot of businesses just going to define contributions and saying, we're just going to give you set dollars and go out to the exchanges and buy insurance, we're not going to sponsor group plans and things like that anymore, then wellness is losing its leg or its business case if we keep attaching it to healthcare costs. And so it needs to be about well-being, not wellness, being at the table as part of organizational strategy. And organizational strategy is looking at how do we help our day-to-day employee experience and what's our culture brand, as well as then how do our employees show up and do they have the energy to be able to bring their best selves forward each day. And it's really that fusion that I think is so critical and that you're starting to see movement happening. But that's the piece that I get excited about because I'm like, there are job opportunities, and instead of being the stepchild that's off in the corner, scrambling for any kind of budget you can get, you're sitting at the table and considered part of the leadership team and helping to direct the strategy of the organization as far as how it impacts employees. I mean, that's exciting and huge to me, but it really requires a different approach.
Yeah, more of a liaison kind of thing as opposed to a person who's putting programs upon people's heads and then kicking him in the butt to get him to do it.
It works really well. Yeah.
Well, I was thinking as you were talking about sort of the healthcare and how it may very well go with the exchanges and such. It seems likely to me that healthcare organizations are going to stop providing wellness, whereas once upon a time they provided it because they could make it their point of differentiation. We give you a better HRA, whatever. So it seems like, the professionals and the job could really be much bigger if healthcare organizations weren't in there sort of in the competition.
Well, it's interesting you say that because that gets into a whole other discussion of being full-time in healthcare right now, in addition to Salveo Partners. what people don't realize that don't work in healthcare is the discussions there are on quality of care and again, trying to help shift the care model. There's so much that goes into healthcare costs. And in the wellness world, worksite wellness, are so focused on its employee lifestyle behaviors. But you listen and talk to actual physicians, and they're talking about, the concerns of how they only have 7 or 8 minutes with a patient, and how the patient doesn't get to what they're really there for until their hand is on the door on the way out, and that physicians are burning out and nurses are burning out. So you look at the broader organizational well-being from a culture standpoint. You have your healthcare workers starting to burn out and not being able to bring their best thinking into those interactions. That's a huge problem. And so there's a lot of opportunity. That's where I go back to the healthcare consumerism and other things, and really understanding what the healthcare community is trying to do and what they need from consumers. And again, it's interesting in talking with physicians and stuff. There's exceptions to the rule, absolutely, but there's a lot of them that get really frustrated with employees that come to them with this laundry list of stuff from this on-site screening that they did, and they're like, oh, for the love of Pete. And when you talk about kind of keeping that relationship within healthcare, sometimes it complicates it and it frustrates physicians because, again, if you think about, you almost end up paying for it twice. And so there's a whole other animal when you get into the whole healthcare space, just them as an employer and what the needs are of those people. But then when you think about that those are the people that are caring for us when we need it, it adds a whole other dimension to it of why we need to kind of rethink some of these things.
Well, here's another. Is your first name really Boomer? That can't be true. Not you. Not you.
Boomer.
No. Okay. Boomer says, I can empathize with you concerning my educational piece, in so much as I just got my MS from a well-known institution who preaches stuck methodology. I'm concerned about others following in the program who would like to know what you and John might be doing in concert with such programs to change curriculum. Well, there's a big piece for you.
Yeah. Well, so first of all, how about get our book into the hands of the the program heads? But that is another conversation that we've definitely had, because the challenge is you do have this this stuck paradigm, I will say, that is educating the people that are coming into this field. Again, you look at, there's multiple levels. There's how do we start to collectively shift what practitioners are doing so that it really is more effective and more meaningful for everybody. And again, we're kind of shifting the trajectory of our field. But then, you get into the people who are being trained in this. How can we look at it differently from the old school, this is what you do, boo, 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 boo. Or if nothing else, I would hope that some of these some of the degree programs that are in health promotion, worksite wellness, whatever they might be, I would hope that just out of the spirit of critical thinking, because you want students to come out being critical thinkers, that they are including, stuff from John and I, and like him or not, including stuff from Al and others, and really having a good discussion, right, about this is the stuff that's out there. And if you're coming into this field as a practitioner, what are you seeing? What are you wanting to do with this versus just kind of being sheltered and here's your textbook and here's how you do it. I think that we're doing a disservice to people coming into this field if we don't expose them and allow them to start to think critically.
I would absolutely agree, and I would hope that maybe this webinar would be shared with a department head, or maybe a nice book as a gift, as you suggested, would be a great place to start. But you're right. I mean, they really do need to be exposed to the naysayers, and not just be a health promotion lemming. You don't have to necessarily agree, but you darn well better be able to understand the argument.
Yeah. Well, and what I always say to people when they say to me, what do you do with this report that came out, or this blog, or this or that? And I always say, channel it into your benefit, right? Because whenever there is a debate questioning what we're doing, that can only help you to have a conversation of, let's have a discussion about how we might do things differently. And so every time something, when I'm consulting and when stuff first came out about the RAND report and stuff first came out from Al and all that stuff, I use it to channel, to have discussions with leaders and say, let be proactive rather than be on the defensive, and say, let's have a discussion about how we could do things differently, because there's some merit to this, whether you agree with the approach or the delivery or not. But if you can use this stuff that is having varying perspectives to have a really good discussion and a really good thoughtful, are we really doing what makes sense? Let's take a step back and not be attached to it and say, is our intent actually having the impact that we want to have? What is our culture brand? When our employees leave every day, what are they telling their friends, their family, their neighbors, that type of stuff? Because that's what matters. Whether people are going to stay here, whether people are going to bring their best selves forward, whether we're going to be able to recruit and retain good employees, whether we're going to grow. And if you look at, we have a blog that will be coming out shortly that I just finished, but if you actually look at the research, for example, that Deloitte does every year on their, and I hate this word, human capital trends, but human capital trends and their predictions, they're based on the survey and the work that they do, something like 73% of, or it's 83%, I can't remember off the top of my head, of organizations, one of their top concerns is the lack of leadership pipeline. Their other top concern is about kind of culture and recruitment and engagement. And so if you talk about making a business case, why don't you start looking at what are the things that are going to impact the top concerns of businesses right now and HR people, and doing wellness or else certainly is not going to help the business case for recruitment, retention, and engagement. Supporting employee well-being and improving culture and including them in the process, that's probably going to have a pretty good audience and more receptivity, I would think.
Yeah, absolutely. Well said. It's almost like, duh. Why wouldn't you be speaking to them in the manner, about the things that they care about? Why wouldn't you be aligning yourself that way? And how could you be off there on your own going, pick that up, don't eat that. Move it.
Yep. And that reminded me, the third, because it was escaping me, the third top concern that they identified is concern about the overwhelmed employee. So again, there's a huge opportunity for health and wellness professionals in that, because we have an understanding of that. But again, are you just going to put in a Band-Aid stress management program? No, because the overwhelmed employee, there are aspects of organizational well-being and quality of leadership and stuff that contributes to that, as well as helping them kind of look at their own purpose in their life and that type of thing. So again, it comes back to that whole fusion thing. I think the top three concerns that are addressing, that organizations are facing right now and worried about, it all lends itself to a fusion of looking at the alignment of both organizational and employee well-being.
Absolutely. Yeah, and how about that overwhelmed employee who's concerned about the premium differential they're going to have to pay for whatever reason that happens to be?
What are the hoops you're going to make me jump through for this when you don't understand that I'm struggling with X, Y, Z, and I hate my manager and whatever else?
Yeah, but here I am at work. Yay! Okay, Stephanie says, Rosie, you mentioned healthcare consumerism. Can you share how you define that and what it looks like for a wellness practitioner?
Yeah, we outline it in our in the book too. I think that there's multiple phases of healthcare consumerism, and I would add on some stuff that we didn't even include in the book. I mean, this book could have been that big. But with healthcare consumerism, I think first and foremost, a lot of people really truly don't know when they're supposed to get care, what type of care they're supposed to get, and they guess. I do this all the time when I'm doing healthcare consumerism trainings. I will ask employees, what do you do when you have a cold? And they'll talk about different stuff. Well, where'd you learn to do that? I learned that from mom. How do you make the determination when you're going to go in and get care? They ask a friend, they go to Wikipedia, they go to social media. They're not using evidence or educated information to make their decisions. They're guessing. And so, what I've learned, and I was, I didn't realize what a need there is out there, is first and foremost kind of self-care. And I know there's been research showing that self-care really does help improve in terms of unnecessary emergency room utilization and other things, but really helping people, whether it's a quality self-care guide, I do like the HealthWise handbook or other ones, and helping them learn how to use mobile apps and stuff, but really helping them say, okay, when something's going on, first of all, how do you make the decision if you're going to get care? And then also, what do you bring to that? So whether you're calling the nurse line or whether you are going to use an online care model or you're going to actually go to a provider, they're going to ask you certain questions. And when we're not feeling well, when our kid's not feeling well, we tend to kind of miss stuff. And so part of that training is not just how to use resources, but how to prepare for calls and visits. So they're going to ask you, how long has it been going on? What makes it worse or better. And so we mentioned a couple of books in our book that you can use to actually develop curriculum too. One is the You Patient, and the other one, I think it's called Smart Choices. You can develop interactive quizzes. I mean, really, it's, as a health and wellness practitioner, it's a whole new space that you can kind of get yourself educated in and be really creative with. And so phase one I call self-care. How do you make the determination when to get care or when not to get care? The next phase is then, let's say you've decided to get care. How do you really set yourself up for success in the healthcare system so that you're going to minimize the chances that you are going to be a victim of a severe medical error? So what questions do you ask? How do you push back if you're not getting the care that you need? Do you have a coordinated care team? Do you have documents in one spot? It could be everything from, do you have a healthcare directive in place? In healthcare in Minnesota, they're having this push trying to get everybody over the age of 18 to have a healthcare directive, because you never know if something like what happened to John's wife, you're going to be in a freak car accident, right? And so having stuff in place so people aren't scrambling, and so people know what to do, and how do you work within that, and how do you look at your medications, and do you know that if you're on 7 or 8 medications, that most healthcare systems have a free service of medication review? And just, there's so much stuff that people don't know because it's so overwhelming. And so build an interactive trainings. And in the healthcare system, they have a program called Choosing Wisely, which they've looked at like the top 5 conditions for various groups that that warrant additional information, and do you really need a chest X-ray if you have pneumonia, and these types of things. And so there's a lot of stuff out there about trying to help people make better choices about the care they do or don't receive. And then it's really kind of, you can do some interactive stuff. So in the book we talk about a program model out of Stanford that really anybody, it costs money to go to Stanford to get trained, but a lot of, through grants, through the CDC and through local health departments, people can get trained for free of the Stanford curriculum on facilitating chronic disease self-management programs. And those have been shown to have profound, significant impact in reducing hospital readmissions. And it's really giving people the skills and tools who have chronic conditions to self-manage better. And it's things like diet and exercise, but it's also learning relaxation exercises, mental distraction exercises, how to better communicate with your provider. And so there's a lot of really good tools out there that you can develop. So you got to help people make the decision if they're going to get care or not. If they're not, what do they do at home? If they are going to get care, how do they kind of go into that healthcare system as a partner? Again, there's that partner word. Those are the types of things. And again, we outline a bunch of that in the book, and we reference some other tools that people can use that you can kind of start to create an arsenal. I used to create an interactive workshop with fake Monopoly money. People would run through scenarios, and say, okay, here's what happened. Oh, you get dinged because you didn't ask the doctor a question. And people loved it, and it really helped them learn. So there's a lot of ways you can be really creative with this whole space of building healthcare consumerism skills.
Well, that sounds like a few resources for the library shelves. Well, Lee says, oh, sorry, go ahead.
No.
Oh, okay. Sorry. I thought I interrupted you. Lee says, so I understand what you're saying in the book. Today I'm actually looking for qualified intrinsic thinking vendors to help us. We have today smoking diabetics with high blood pressure and hypertension. They want us to help them, and we need the clinical intrinsic focus vendors to help us. There's some interesting things out there, but not as many options as I thought. And I guess he's working on this today. So, thoughts? Can't you help this poor man?
Yeah. Well, so a couple things. So one, what I'll just say. So my role outside of Saleo Partners is with a organization called Fairview Physician Associates, and my role there was actually to come in and overhaul their health coaching program. And I've talked to some other people in healthcare about how internally could you overhaul your model. And my first order of business was to get all the coaches trained and certified through intrinsic coaching. And then we overhauled the whole model of how we support people, whether they're smoking or chronic condition. And it's a whole person focus. So you could certainly find people, you could talk to Intrinsic Solutions International and see if you can find certified intrinsic coaches, in your area. You could, if you're doing it in house, you could certainly send people to training like I did. But if you're looking for a vendor, now it's only phone based, it's not in person, but the one that I used a lot with my clients was the only one. In fact, when I was working with vendors, I specifically requested, I'm carving out your coaching, because usually I thought most of it was not good. And I use Progress Health Coaching. So Progress Health Coaching is Gail Johnston is her name, and I believe she's out of Colorado. And Gail herself is a certified intrinsic coach, a certified valuation specialist. She's been through the highest level of training that Intrinsic Solutions International offers. All of her coaches are certified intrinsic coaches. They've had more than 100 hours of training. She has one of the intrinsic coach mentors on staff who actually trains other people. And so we used, when we were putting this into organizations and looking for phone coaching options, we would use her. But as far as if you're looking for kind of in person and stuff, then I would reach out to Intrinsic Solutions International and find who might be in your area that is certified and start to have some discussions.
Great. And I'm sure that your check is in the mail, because that was a nice promotion for her.
I get nada. Trust me. For 10 years I've been using this and researching it, and it works. And so, and I'm seeing a huge difference at the healthcare system where I work. Our results are like phenomenal right now. The people who are saying, I never realized how much my thinking impacts my food choices, and I finally get it. It's not about the weight, and I'm finally have quit smoking. And I mean, because you're addressing the thinking and you're addressing the adaptive part of the challenge, and that's the piece that we've been missing so much. And I just see such a huge difference. So that's why I'm such an advocate for it. I promise you, I don't get any commission. I get $0. I was
totally kidding.
Yeah, I know, but I'm passionate about it because it works.
Well, that's totally totally obvious, and that's fabulous that you're getting that kind of results.
Yeah, it's very cool. I'm very excited about it. Yeah.
So Bill says, from a model perspective, wellness and well-being are not that different. Is the term wellness so damaged by the medical model that it can't recover, and that are you proposing that we just kind of go away from that and suggest and use well-being? Do you think, I guess, how much does wellness versus well-being matter in your opinion?
Well, so I think that in theory they both mean the same thing, right? I mean, if you go back to National Wellness Institute's model of wellness, that had 6 dimensions, and it was very holistic and other dimensions. I don't think the word wellness itself is bad. But what has happened operationally and what has happened with our field of it becoming wellness or else, you talk to most people and you ask what they think about employee wellness programs, and they roll their eyes or they have some expletives that come out of their mouth. The people who like it are the people who work in it. and so again, I go back to intent versus impact. And so why we are so deliberate about changing our language is because of the operationally what has happened in the connotation. Now, if wellness or else, if well-being starts to shift its trajectory and it's no longer this wellness or else, and it's not something being done to employees that is 17th century control oriented, would people then maybe be more open to re-embrace the term wellness? Possibly. It's just more, it's more of an intentional thing to say this is different. So when I would go into organizations and they had wellness programs and we were trying to relaunch and help employees see that it was either being repositioned as a benefit of employment or a platform for, their employee experience, that type of thing, we had to be very intentional and say, in the past, we've done a wellness program, and here's what we mean by well-being. And the wellness program was primarily focused on physical well-being, and we want to broaden it. And so we're intentionally expanding the wellness program to be a well-being benefit or well-being, whatever you want to call it. And that language was very important in helping employees see that this was going to be different, but it still takes education, because then you could say well-being and they're still thinking wellness or else. So again, I'm not anti the word wellness. It's just based on what it's become. And again, being out there for all these years and talking to employees, it's like a 4-letter word for most employees and not one that they like. And so And so if you want to set yourself up for success and have people be part of it, you don't want that barrier right off the bat by them going, ugh, you know? So that is part of the intentionality of using well-being. Again, I think that it's more about operationally and how they're received than anything.
Okay, here's another Bill question. Humanistic management has been around since the 60s. Why might it work now when it's never kind of gotten, it's never gotten a fan club in the past?
Yes. Well, I think part of why it didn't get a fan club was you're dealing with scientific management and Frederick, Taylor, and really looking at how can we control, and it was getting down to, the growth of lean and Kaizen and stuff. It's all about how can we break stuff down to their component parts and find the most efficient way to do things and kind of take the human part out of it. And so I think you had to look at what was happening in the industry, that it didn't get a whole lot of traction. But I think if you look at the era we're in today, yeah, there's still manufacturing jobs and things like that, but everywhere you look, we talk about we're in a new era. This is the era of the knowledge worker. This is the era where people can work anywhere. They can do their, off the tablet, off the laptop. They can do their job off of a coffee shop. And it's going to be really critical for businesses to think about their operations being in a new era to, again, going back to those millennial employees, to recruit and retain them, because that's the future workforce. 75% of the workforce by 2025 is going to be the millennials, and they have a different sort of demand. So I think it's a perfect storm of now that the economy is recovering, employee engagement efforts were kind of put on hold for a while, and now they're competing for top talent. And if you look at like the companies, like the firms of endearment organizations, they get that company culture is their main competitive advantage. And so with that, you cannot recruit and retain top talent and be a leader in your industry if you have cruddy leaders, right? If they're back to the old control oriented, paternalistic, it doesn't work. And so I think that there is a renewed interest in understanding humanistic leadership and understanding the importance of servant leadership and transformational leadership. And actually in the leadership world, for many years, they've been talking more about fellowship. It doesn't even matter what your leadership style is, are people following you, right? And so it's understanding that this shift has been happening even in the world of leadership development, and that, I think it's a perfect storm. And I think that well-being kind of lends itself to that too, because again, if you have a leader that is just driving you and doesn't care about you being overwhelmed and stressed out and treats you like crap, and your well-being is going to be eroded, that's a problem. And when you look at the research, again, this intersection, there's a lot of research that has come out to look at the relationship of leadership style and employee well-being. So transformational leadership style versus transactional leadership style is associated with much higher levels of emotional and physical well-being. And servant leadership as well. So I've been working with actually several organizations just trying to look at, they have these old school leaders that are very transactional, that are pushing back on the organization's effort to try to develop them to become more of a transformational servant leader. But they're saying this is really critical for our growth. So there's some interesting dynamics happening in that leadership development space as well, and I think it just lends itself. That's why I keep saying we have to broaden our discussions and bring different people to the table and bring different discussions, because it all goes together, and we can do so much better work if we collectively come together.
Absolutely. I think about these leaders and wonder, are they super young people? Because if they've ever had a teenager at home, they should really know better than this stuff.
Tell them what to do and see how all that works.
Yeah, really. How is that working for you?
I can tell you with a 4-year-old it doesn't work very well.
I know, and it only gets worse. I'm sorry.
Yeah.
Okay, here's a question from Della, I think. We're just starting a health coaching program at our work site. It's quite overwhelming to get started and establish a best practice. Are there some recommendations on best resources? There are so many. That's for darn sure. There's a gazillion.
Yep. Well, that one's loaded, and there's a lot to that. I guess I would go back to what is what is the model, what is it you're wanting to accomplish. So like, for example, if you want to just have it be a resource for employees, when I was working at Northwestern Health Sciences University, they just changed part of my job description where 20% of my time was coaching employees, and I had open coaching hours. And then as part of that, we did a pilot study and actually created what we called a lifestyle makeover program, and it was 6 months of focused coaching with resources. And I've actually used that model now at my role at Fairview Physician Associates, a 6-month coaching model, where it's 3 in-person sessions and then phone in between, and a lot of resources to really focus on helping people identify when their thinking is serving them well, when it's not. You have to think about what metrics you want to collect. So I kind of go back to taking the step back of, okay, you can do this stuff, which is great, but what was the guiding force, I guess, of wanting to put in the coaching? What are you hoping to accomplish by it? Who has access to it? Is it an internal or external? Those are all things that need to kind of come to consideration. And then I think your plan will start to reveal itself of what data do you collect, how do you deliver it, how do you test it, how do you figure out what works? Because there's a lot of different ways you can go about it. If you're doing more of the what I would call the DDO, the deliberately developmental organizational work, that might lend itself to one model. If you're trying to focus on health and well-being strictly, which I don't know how you really can, but if you're just trying to kind of do that, that might lend itself to one model. If you're doing it in-house versus using vendors, so I guess I would just say go back to what it is you're wanting to accomplish, and then kind of see what strategy makes sense for your people.
Excellent. We've got a bunch of questions on vendors and how to work with vendors and how to get what you want out of vendors. Can you suggest anything?
So I was probably, as a consultant, vendor's worst nightmare.
Somebody's got to do it.
Well, but I guess the best way that I can say of working with vendors is you have to be true to what it is that you are wanting to accomplish, whether it's internally or for your clients, and basically be really, really clear about what that is and where they fit in. And here's why I say that. So, and I get it, but I don't care what they are. Every vendor that I've come across that I've ever tried to work with, they think that they have the magical solution and they can do everything. Nobody can do everything well. And so in the book, we talk about the worst thing is run far away from a turnkey solution. There is no such thing. So it's looking at, where do you want to use a vendor? Is it because you need a web portal? Is it because you need coaching? Is it because you're looking for someone to provide financial well-being education or mindfulness-based stress reduction, or whatever it might be? And so usually it lends itself to, you have to work with multiple vendors or partners or whatever it might be, to help support whatever strategy you're trying to deploy. When you let the vendor take over the strategy, you're in trouble, because they're going to, all of their programs and products and services, and you're going to get kind of stuck into that. So what I would say with vendors is, I would say, okay, first I work with my clients to help them determine kind of what the strategy was, what they were going to do from a programming standpoint, transformation point number 6. So that's further down the road, and say, okay, where do we need support services and which vendor might be a good fit? In starting to move clients away from biometric screenings and health risk assessments, and my clients who wanted coaching, my first question with any vendor that we were doing screenings with was, can we carve out your coaching? If they said coaching was part of the package, they were already, we can't work with you, because I knew that I was going to use intrinsic coaching. For me, that was just a sticking point for me. So I would say I want to carve it out, and either we were going to do it or we were going to use Progress Health Coaching. So that eliminated a lot of vendors right off the bat. Any vendor that said that they had a turnkey or a kind of a cookie cutter platform where you couldn't do a lot of customization automatically was off the table. So it made it really pretty easy. For us, and I guess, and then if they had pushy salespeople or whatever, that kind of took it off the table. So my approach now is, now that I'm kind of, I'm away from my previous role where I kind of inherited clients that I had to use some of these vendors, my approach now is saying, okay, is this really working for you? And really kind of how can you move away from the screening contract? If you're not tracking and doing point stuff, do you really need a web portal? Can you instead just look at what people out there, there's actually a great vendor right now that does some online cognitive behavioral therapy to help with emotional well-being. It's more looking at who are the vendors that support your strategies. So again, I would say take a step back and look at what is it that you are wanting to accomplish internally, if that's your role, or if you're working with clients, what is important to that specific client, and then kind of look at who are the different providers out there that can do that. And so, except a lot of the wellness vendors, in my opinion, I eliminated right off the bat just because of their platform was so stuck in the old paradigm that it just wasn't going to work with what I was doing.
Yeah, as you were talking, I'm thinking, there was a time, 15 minutes ago when, we have a web portal. That was kind of the sexy catchphrase.
No one uses them except to log in and they go, oh my God, I have to track something. So it's like, okay, well, is that really use of your investment?
Right.
Is there another way you could look at this? So
yeah, absolutely. Here's a question from Debbie, who wonders, can you compare and contrast sort of intrinsic coaches or intrinsic coaching versus, the other top names that I don't have to mention out loud?
Well, so again, keep in mind, I was introduced to this 10 years ago, and I've done studies on this, so I get that I know other people who have other coaching backgrounds who are very good, that do work on my, this. But that being said, here's my experience from people who have gone through intrinsic coaching training, who were trained with other coaching, or in my experience is that, again, if you read the book, this will make sense. But it's really about the thinking and the approach of the coach. So on the surface, you could listen to a coaching conversation and it could sound like, well, they're the same. But it's really the intent. Again, it's the intentionality of who I'm being as a coach. So if I am being in a way of I already have a predetermined agenda and I am trying to get you to figure out your motivation for exercise, or I am trying to get you to do this, or my job is to get you to move through a stage of change or whatever it might be, I'm in this control. I'm not looking at you as a unique individual. I'm not looking at you through a lens of intrinsic greater than extrinsic greater than systemic. I'm looking at you as the opposite. I have an idea of who I think you are. My job is to get you to do X, Y, Z, so I'm going to ask you these questions. And so the primary difference between the two is in intrinsic coaching, it really is, again, this is why I use it for leadership development, and even been using it in developing physicians right now to help with that whole patient experience, it's about how you think. So if I'm a leader and I'm interacting with my employees, unless I can start to recognize when my thinking is serving me well or when my systemic thinking is hijacking my brain, I'm going to look at that person through a lens of SEI and look at them as an idea about them. But if I can recognize when my systemic thinking is kind of hijacking, if you will, and have the skills to be able to disable that, I can suddenly listen more. I can suddenly be fully present. I can suddenly hear more. But that takes a lot of work. So it's really, the intrinsic coaching is really taking people through their own adaptive change journey to shift how they think and how they self-manage. And then therefore you can't support other people until you can work on yourself first. And so it's really personal growth and development more than learning tools to be a coach. But along the way of that personal growth and development, you learn tools that you can support other people, if that makes sense. So for me, that is the biggest difference, is it's actually personal development. It's actually shifting how the individual thinks. And so whether people want to become a coach, or again, I use it, as you read in the book, a lot for leadership development, because it's huge in terms of people truly feeling valued. The leader has to bring different thinking to that interaction.
Awesome. Kevin wants to know, we're just about out of time, unbelievably. Have you heard of the book Lessons from Second City, and have you used improv as a way to build a thriving culture? I have not heard of that book, but it sounds totally fun.
I haven't specifically heard of that book, but I do implement principles from improv when I'm facilitating groups, because again, a lot of improv actually kind of gets it. It's about the thinking and trying to get people out of one part of their brain into a different part of their brain. So that's a lot of what improv is. So there's actually a lot of lessons that we can pull from improv comedy and what they understand about the brain and kind of getting out of the way. And there's actually some business consulting that is centered around improv to get leaders, especially when you're trying to do strategic planning and things like that. So that particular book I'm not, but I actually do. Luckily, I married a man who is very comedic, and I learned principles of improv years ago, but I do integrate those into what I do, because it's really, again, about tapping into a different part of the brain that kind of gets stuck.
Awesome. Well, I've got a book in mind for the airplane.
There you go.
I know. So, Yeah, so I guess for people who don't know, you're going to be in San Diego next week doing a pre-conference for the American Journal
It's
of Health
1
Promotion
o'clock.
Conference.
Yep.
So if you're going to come to the conference, come early. If you are in San Diego already, you are so lucky because it's warm there.
Yeah.
But yeah, it's going to be great to see you, and we totally have to talk more about all the things we were talking about before we went on, and a lot of the things that you've just talked about, because I think HP Live could benefit from a whole lot of recommendations from you, because you are obviously out there making the change happen.
Trying to. So.
Yeah, well.
Well, and I just want to, put out there, and people who know us get this, but, when John and Sean and I came together to create Salvia Partners, we kind of said, this is, call it utopia, call it Pollyanna, but it's really about feeling this calling of, okay, how can we really bring, help move this forward? Because one person can't, and yeah, you say one person can't make a difference, you can, but it's really collectively of how do you start to, between the book and other resources that we're trying to provide through Salvia Partners, equip other people to be able to do some really important work, because there's lots of work to be had out there, and it's like, okay, how can we start to be a voice and really shift this trajectory that's going this way, that's going to go off a cliff pretty soon, to this way where we can actually all feel fulfilled in our work and make a difference. And so that was our whole intent of kind of behind the book and Salvia Partners, is saying, how can we kind of create a platform, because people kept saying, how can I do this? How can I do what you do? How can you help me? Give me a model. And so I'm just grateful that that we're getting such a great response to the book so far, and that people have been so supportive. And we're kind of creating this as we go of what are people wanting, which is kind of a cool way to create a business, I think. It's really about what are people asking us for and how can we create it.
Absolutely. And as you said, maybe it's a little Pollyannish, but we can all win. We can. This can be a total win-win.
Yeah.
So
yeah.
So let's do that, shall we?
Let's.
All right. Okay, work is done. Have a nice weekend.
Yeah.
Thanks so much. It was so fun chatting with you, and thanks everybody for being here. There were more questions that we plain didn't get to, but I'll send them to you, or Kelly will send them to you.
Yeah, send them to me, and I'm happy to answer them.
Okay.
Absolutely.
And I'll see you next week, and we will totally go to Sips, because it's an awesome vegan place.
Nice. Great.
Thank
you for having me. Thanks, everybody.
Take care. Have a good weekend, really. Bye-bye.
Bye-bye.
Happy spring.
Yeah.
Bye.